Obesity is linked to diabetes. According to the World Health Organization, every year 2.8 million people die due to obesity. There is still a debate on whether obesity is a disease or a condition, but it is obvious to know that obesity gave birth to other chronic diseases like CVDs, hypertension, joint disease, and diabetes. Almost 90% of individuals diagnosed with type 2 diabetes are obese. Insulin allows your body cells to use the energy produced from the glucose molecule. Being obese increases the risk of developing diabetes. Mostly, obesity-induced diabetes is type 2 diabetes, and it is known as diabesity. In this situation, our body produces and releases enough insulin to metabolize glucose, but cells become resistant to this insulin. In obesity, inflammatory chemicals and fatty acid levels increase in the body, leading to insulin resistance. Overeating stresses the cells of endoplasmic reticulum as it has to process more metabolites than the average amount. ER sends signals to the surface cells to lower the number of cells responsible for producing insulin. When levels of insulin are lower, it ultimately raises the levels of glucose in bloodstreams, resulting in diabetes. If your BMI, or body mass index, is higher than the standard value, you are at risk of developing metabolic syndrome. A metabolic syndrome is a cluster of disorders including diabetes, atherosclerosis, inflammation, hypertension, and dyslipidemia. In an obese person, adipose cells have to process more nutrients than their capacity. Greater burden causes stress within the cells and triggers the process of inflammation. Due to induced inflammation, a chemical known as cytokine releases in the cells. The cytokine blocks the signals of insulin receptors, thus making cells unable to respond to insulin. And if the condition is persistent as fat intake not managed, cells become more resistant gradually. Increase in blood glucose levels can result in type 2 diabetes. There is no claim yet made to proven direct influence of obesity on diabetes, but studies have shown that obesity factors up to contribute towards type 2 diabetes. Obese people are 80% more at risk of developing diabetes type 2. Fat cells, also known as adipose cells, are involved in inflammatory responses. Fat cells release pro-inflammatory chemicals by making cells less responsive to insulin. The development of insulin resistance is the most important phenomenon in understanding type 2 diabetes. The link between type 2 diabetes is as weight loss improves the efficiency of insulin by decreasing the blood glucose level. Similarly, rapid weight gain and physical inactivity worsen type 2 diabetes and its management. Obesity appears to be in shape. In men, obesity results in apple-shaped body. In women, the body seems like a pear in shape. However, altered situations may also be present. In apple-shaped obesity, there are higher chances of insulin resistance, and thus diabetes type 2, as most of the fat accumulates in the belly area. Whereas in pear-shaped obesity, insulin resistance does not occur as fat accumulation occurs in regions of the hips and thighs. Weight loss is an important goal for persons who have type 2 diabetes. Weight loss of up to 10% may decrease insulin resistance significantly. Type 2 diabetes is mainly associated with being overweight, so treatment primarily focuses on exercise and improving health through diet. Diabesity is easily preventable if a person knows how to manage weight within healthy BMI ranges and adapt lifestyle modifications. A preventive approach is highly recommended as both obesity and diabetes decrease the life expectancy and quality of life.